Hi guys, Dr. Geeta Verma here again. So if you are wondering what happens in your first rheumatology appointment, uh, so initial rheumatology visit is a thorough, detailed investigative process which is focused on gathering enough history to accurately diagnose a complex rheumatological condition. It usually takes longer than a routine follow-up appointment. So here's a breakdown of what will happen in your first rheumatology appointment. First is a detailed medical history review. This is often the most critical part of the visit as rheumatic conditions are highly dependent on patient story. The rheumatologist will dedicate a significant amount of time diving into your symptoms, such as they will ask very specific questions. So most patients will have joint pain. So they will ask you about when did your symptoms start and how they have changed over time. Then they will ask you about location and nature of pain, which joints are involved. Is it one joint, multiple joint? What kind of pain is it? Is it dull, throbbing, sharp? Or is there any swelling of your joint associated with it? Do you also experience stiffness when you wake up in the morning, which is called morning stiffness? So these are the key differentiating factors that differentiate inflammatory arthritis from normal wear and tear arthritis. They will ask you about alleviating and aggravating factors, such as what makes your symptoms better or worse. For example, is it improved with rest or worsened with rest? Does activity make it better or does activity make it worse? Or have you tried any over-the-counter medicines? They will ask you questions about, do you have any systemic symptoms, which means all over body symptoms associated with it. For example, fatigue, fever, unexplained weight loss. Do you have symptoms like skin rashes, dry eyes or dry mouth that could point towards lupus or Sjogren's syndrome? They will also review your past medical history, family history, past surgical history. They will carefully investigate all the medications you take. So don't forget to bring a list, and sometimes bring your bottles with you because lists are not always accurate. Any over-the-counter medicines or supplements that you take. They will ask you about any similar history in your family members, such as other autoimmune disease or arthritis that run in your close family members. Next is targeted physical exam. So the rheumatologist will perform a specialized physical exam focusing on musculoskeletal system, such as they will examine your joints carefully, like the small joints of your hands. They will press on it, wrist, elbows, shoulders, knees, ankles, feet, toes, to look for signs of inflammation. They will feel for synovitis, which is swelling in the synovium of the joint, or effusion, which is some large joints. When they have synovitis, we call it effusion, where there is a lot of fluid around the joints. They will examine your muscle for strength, if you have muscle weakness, tenderness or palpation. They will examine your range of motion to look for flexibility of your joint. And they will also examine other areas like your skin to look for rashes, nodules, lymph nodes in your neck, armpit or groin to look for any lymphadenopathy. They will also listen to your heart and your lungs. And then next thing is lab and imaging orders. So if you have any prior labs within the last 3 months before your rheumatologist appointment, that's good enough, but they will still order additional lab test, which is going to be directed towards your history. The most common labs we order at our initial appointment are a complete blood count, complete metabolic panel, where we look for your kidney function, your liver function. We often check inflammatory markers like ESR and CRP. Some additional tests that we order include checking for chronic infections like hepatitis, HIV. Sometimes we also check for TB, because if you are one of those patients who end up on autoimmune medication, we need to rule out all the chronic infections. And depending on what your history is pointing at, Your rheumatologist can also order antibody tests like rheumatoid factor, anti-CCP antibody, or anti-nuclear antibody, which we often call ANA. Some other tests that they will order include X-ray to look for damage of the joint or erosions. And occasionally they can also order an ultrasound to look for soft tissue swelling or synovitis in your joint, which is a little bit better than X-ray. Rarely they will order MRI or CT scan. Now, after this initial diagnosis or next step, the rheumatologist will give you their working diagnosis. They may not tell you what exactly is going on unless the symptoms are very obvious and your recent lab test is very obviously pointing towards your diagnosis, but they can give you a working diagnosis. They will discuss their preliminary thoughts and what they are ruling out. And then treatment plan will depend on how severe your symptoms are. If they are really limiting your life, they may prescribe you some anti-inflammatory medications to manage your symptoms while they are waiting for your test results. And then they will schedule a follow-up visit to review all of the test results that they have ordered and go over all those results with you. So here are some tips if you are preparing for a rheumatology visit. Make sure you have a symptom diary and how it's impacting your life, what medications you have tried, if you have difficulty remembering all of these things at your appointment. And if you have a Raynaud where your fingers turn white on cold exposure or a rash that comes and goes, I would encourage you to take pictures so you can show it at your doctor's appointment because it may not be there when you are going to doctor's visit. And bring your medication bottles at your appointment so they can review them all with you. So here are some examples of initial rheumatology visit.